here this morning with a couple of our seasoned drivers, Jim Beeson, wave Jim, and Derek Meyer. So Jim and Derek have been with us through the duration of all of the pandemic, and we're going to ask them a couple questions today about kind of their experience of it. So what unique challenges did you face during the pandemic with transportation?
Unique challenges. Just the dynamic shift from the way we used to be able to transport people and to how we had to start transporting people with the social distancing and the mask wearing, and the
first initial challenge was that we're a hands-on job and we had to become suddenly hands-off, and it was very abnormal and not what we were used to. We're used to escorting people, and we had to move to distancing from people, but still trying to keep them safe.
How did the customers react to that difference and those changes?
You know, I'd say, considering everything, customers adapted pretty well. Everybody knew what was going on, especially at the start. Everybody was so skittish while we didn't know what was going on that people wanted to be safe and everybody was okay with it. But that doesn't help somebody that's not very steady on their feet who needs an arm.
True. What's changed and will continue to when it has to deal with the safety of the drivers or passengers?
I think as the mask mandates leave, ours is set to expire at the middle of this month. I'm sure we'll still have riders and maybe some drivers that continue to want to wear that for their perception of safety. Other people are ready to get on and move on with it. I think those are the biggest changes coming soon. And then seeing more people on the vehicles, where 2 years ago we were maybe transporting one person at a time, and now we're getting 6, 8 people on there at a time. So
more back to normal workloads.
Right.
Yeah.
And the population's ready to get back to normal too.
Right. Yeah. And another change is just the escalation of the cleanliness of the buses, which I think is something that's good to keep anyways, just when you're transporting lots of people.
Yeah.
Okay.
Right.
Kind of generally, what's the best part of your job?
Best part of my job is, like we tell everybody we train, is you get to drive around and help people and talk to people all day.
And you get paid to do it.
You get paid to do it. Yep.
Serving the people of Linn County, to mirror what Derek said, just being able to serve them and do what we need to do for them and get back to doing that, getting them out and back involved in the things that they like to do. So just serving the people is it. Yeah.
Yeah, like you guys said, I always tell everybody when they ask me that sort of a question in the meeting, I go, if I would have known I could have got paid to help people,
Right.
I would have been doing this 30 years ago instead of only 15 years
Kept
ago.
secret.
Yep.
It's a good, very good kept secret.
Right.
So what have been some positives that have come out of the pandemic?
I think it's made us tighter as an organization. You go through a couple years where you're worried about the safety and of your colleagues and
Right.
sickness and
Right.
you know,
And then on our riders too.
and on our riders too, and it wakes you up to the fact that there's a lot of people when an emergency like this happens that are fortunate that they can back off and stay safe, but for some people public transit's their only option and they have to take it. And
Right. Yeah.
And they still need health care. Our populations,
They still need
our
health care.
populations need
Right.
health care, and they need it disproportionately probably
Right.
to the
Yeah.
general public. So
exactly, some things don't
Yeah.
stop.
Yeah.
So we've already talked about you're providing a valuable service to the community. We all know that. What has been your favorite interaction with a rider that maybe helped you through the hard times?
For me, it was trying to maintain in an adverse environment to maintain that sense of normalcy and being able to interact with people. 2 years ago, everything drawed down so tight that we were just seeing a few people a day. and then it was you were used to seeing the same people daily for years. All of a sudden you're not seeing them. You might get a phone call or make a phone call, but then once people were starting to ride again and services started to open up, it was like a family reunion. Where you were able to sit and laugh and talk with people that they'd been isolated and we had been isolated.
Right.
Catch up with family.
Exactly. Yeah. Right.
Yeah, definitely. And I think that it shows how hardy people are, because through it all, people have kept their sense of humor. I wouldn't say there was ever any times with passengers on the bus where people felt stressed or scared. Everybody still conversated pretty normally. Right. Everybody still made jokes, and you know, temperature stayed healthy.
Right. Yeah.
So talking a little bit more about healthcare. So you regularly provide rides to dialysis, medical trips, dental, cancer centers, more and more. Mm-hmm. What are some of the best moments that have come from providing the access to healthcare? Anything that stick out?
Boy, Jim, give me a second to think.
I think being allowed to be able to do that, to get them where they needed to go, because if you were facing a health crisis and a pandemic starts, I think the first thing on their mind was, I'm not going to be able to get my treatment. I'm not going to be able to see my doctor. Once that was worked out and they were able to do that, it took a lot of anxiety away from them. Yeah. And you could see that they took the pandemic serious, but they were more worried about getting the treatment that they needed.
Right.
That was front on their mind.
Life-saving.
Yes, life-saving.
Life-changing.
Right.
Yeah.
So
a lot of people were fortunate that they could take a laptop home and kind of lay low for a long time. But if you got to go to dialysis, you got to go to dialysis. You don't get to hide out from that.
And it's hard to drive a bus from home too.
It's hard to drive
Speaking
a
of
bus
that,
from home too. Right.
Speaking of
That's
that,
right, yeah.
very difficult
That's
to
true.
do this from home.
Yeah.
So just to kind of wrap it up, what do you have to say to everybody who listens to this video and your community and your riders?
I'm happy that everybody's pulled through. It's been a lot of hardship the last couple years, but things are starting to take shape back to normal. It feels good to be back. It feels good to see it. The majority of people have come through okay.
Right. To see the social interactions with the riders and the people in the community, and hear their laughter, and hear that they're ready to move on to everybody that rides these buses and the places that we took them to. There was a lot of loss over that first year and a half, and to have that thing turn around a little bit, hopefully we've turned that corner and get things a little bit more normal. But like Derek said earlier about their resiliency and their strength, they worked through it, and we are working through it with them, and it's nice to be able to get back to having these buses full and not just one at it. It's good for them and it's good for us too.
Yeah, and I think that as a community and as a society, we're kind of getting back to a new normal. The old normal may just not quite exist the way it was anymore. So anyway, thanks guys for your time this morning.
Thank you.
And drive safely.
Yes.
Really, the overarching challenge that I think all transit systems faced during the pandemic was having to completely adapt what we do and how we do it to maintain an essential service as safely as possible, which, looking back, feels like we had to do almost overnight, implement as many mitigation measures as we could to maintain service. As we look back on it here at DART, I know one of the things that we're very proud of is the fact that we never stopped providing service throughout the pandemic. And one of the reasons for that is we know that there are thousands of Central Iowans who rely on public transportation as their primary means of transportation. And that during such a difficult time, taking away an essential service would create even further hardship. So that certainly wasn't something that we wanted to contribute to, and we worked really hard to put all of those safety measures in place to be able to keep our operators safe, to keep our passengers safe, and continue to provide those essential trips and make sure that individuals who were working in essential jobs could still get to their work, as well as access essential services, going to the pharmacy, getting their groceries, all of those things that we know were still really important. So as the pandemic continued to evolve, DART had to continue to evolve. So we had to become really good at being flexible and nimble. In a normal year, we would implement about 3 service changes. With all of the evolving changes throughout the pandemic that impacted both our ridership and the demand for transportation services, as well as our available workforce, we had to implement probably almost 10 service changes in a year, which is more than double what we do in a normal year. And so really thinking differently about what we do and how we do it and being able to act quickly was extremely important for us to be able to meet the needs of both our workforce and of those who are relying on us to get to where they needed to go. We're really already seeing a lot of changes in travel patterns and when people are traveling as a result of the pandemic. Our peak travel time used to be those traditional commute hours, a little bit before the 8 a.m. Hours and 5 p.m. hours, that traditional work commute, and that's shifted already quite a bit. So we know, people are choosing and now need to travel at different times of day, and so there's a demand for traveling at different times of day, and we have started to and will continue to adjust our service to where the demand is. We anticipate as we continue to see where that demand shifts, there will be more demand in evening hours for more weekend service and things of that nature, as well as more flexible transportation options, such as on-demand service. And that is something that we have started to test here at DART in Central Iowa. We introduced our first DART-operated on-demand service in the city of Ankeny back in November, and that replaced a prior on-call service where individuals had to call at least 24 hours in advance and book their trip. So by shifting that service model to on-demand, as well as expanding the times of day that the service was available, since launching that service in November, we have already more than doubled the ridership that we had previously. So we are seeing that adapting to these demands and providing more flexible service options that meet the different needs people have is working. Prior to the pandemic, a lot of our larger partnerships were with big employers here in the Central Iowa area who were offering a transit benefit to their employees. And we are very fortunate. We have maintained many of those partnerships and very much and are very pleased with that. Throughout the pandemic, however, we identified an opportunity to sort of expand how we think about those partnerships and who could be offering a transportation benefit. And that includes partnering more with the residential sector, the property owners, to offer a transportation benefit to individuals who are renting and living in their apartment complexes. And so we've introduced a few of those partnerships so far and found them to be very successful and have had positive feedback both from the renters who are using the benefit of accessing DART for free as a result, as well as the property managers too. One other unique partnership that came about during the pandemic is more in line with healthcare. Because we worked so quickly to adapt so many different mitigation measures, we were able to really continue to safely transport people to where they needed to go. And the Iowa Cancer Consortium was looking for a transportation provider who could help transport cancer patients who still needed to receive their cancer treatments during the pandemic. And they turned to DART because they were aware of all of the safety measures that we had in place and thought that we were one of the safest options out there. And so we were really, really pleased and thrilled to be able to partner with them to help those cancer patients continue to receive their treatments throughout the pandemic. One thing we know is many people have a higher bar for cleanliness and overall safety, and that certainly includes our operators and our passengers. So, as we look to the long term, what remains in place in terms of some of the safety measures and mitigation measures we implemented as a result of the pandemic, we know there's several things that we plan to keep long term. For example, at the start of the pandemic, we started to sanitize our buses every day, and that's something that we will continue to do. We also installed, really at the time, the best we could do was temporary barriers for our operators to have a little bit of separation between them and all the passengers on their bus. Now we're in the process of purchasing permanent barriers to provide some layer of safety and protection between operators and passengers as well. So those are just two examples. There's probably many more, but we are committed to, even as we come out of this pandemic and find the new normal, we want to ensure that people continue to feel safe and know that we're doing everything we can to keep our service safe and maintain health as well. Transportation is so critical in order to ensuring that people can even get to their doctor, which is something that many people can often take for granted, while there's at the same time many people that don't have the luxury of taking that transportation access for granted. And so it's really essential part of the overall health of the community. With that, I think there's two key things. One is, as we plan our communities, thinking about where we're locating medical facilities that are providing care to the general public, and as much as possible locating them along where transportation services already exist. The other thing is really looking to equip healthcare providers with more centralized tools to understand and access what transportation resources are available for patients who may need some assistance with arranging transportation in order to get to their appointment.
I've been here with DART for almost 10 years, and I work in the paratransit department. First of our questions here is, what's the best part of your job? Right off the bat, it's coming to work, being appreciated, being needed. It's a necessary job. So you're needed, and you go out and you greet that client, and they're happy to see you. That is everything for me. That's the best part. But I guess the best part is that, well, first of all, I'm a part of my employer. They're very understanding. If anyone got sick or there are any issues like that, they could stay home. In fact, they encourage you to stay home. And the wages were covered, and they made it very easy to be responsible. And you always hear, if you're sick, stay home, and they mean it because they understood the gravity of the situation. So that was good. Other thing is, I think everybody stepped up and did what they had to do. That was key. That you buckle down and you do it. Just the job in general. People were pretty understanding, when you'd ask them to do something like wear a mask, or they'd see you cleaning your hands after you touched anything, and they realized it was for the common good. So people came together and understood the gravity of the situation.
Very good, yeah.
All right. I think that is a good question. And for me, I would show up on a scene, and rather than being a routine situation, taking someone to something as simple as a grocery store or Walmart or something like that, you get the ones that are more serious, like taking someone to a clinic or a dialysis patient who has to go. But above all of that, the best is when you show up and the client is there and the client's family is there, and you realize they need you, and you can show up and put them at ease, that sort of thing. And then the second time you show up and they see you, they're like, oh, this is all going to work because it worked last time, and you're putting a whole family at ease, that sort of thing. Along with that is especially when a person is new and you get them to a doctor's office, a very busy place like the Iowa Clinic out in West Des Moines. It's a very complex place. Is going in there with them, checking in and making sure they're at the right place. So when I hand them off to the staff there, I can walk away and know that they're fine. They know that they're fine, and that sort of thing. Rarely does it get that intense. I mean, sometimes you take someone to church or you take them to Walmart, and that's no big deal, but they still have to go. So you'll stumble into a situation where the person may need more help than they're currently getting. They may need a ramp in front of their house. They may need a wheelchair instead of a walker. You see a guy with a walker trying to go up and down stairs. And I can relay that to my supervisors and put a bug in their ear that this client is, it's on shaky ground when we have to move them, and the potential for an accident is there. Another thing you can do is if there's just something that's bothering the client. The other thing we do is we partner with the United Way, and we have a card that we can distribute. And it's very simple. Everybody in this country knows if you have a problem, you dial 911. If it isn't that serious, but there's an issue, you can dial 211. And that gets you the United Way, and if they can't give you an answer right away, they can refer you to someone who can help. And that just gives them peace of mind, and letting them know that we care, and there are other people out there who care, who may be able to assist.
Yeah, it's kind of cool that we're providing on a lower level some of those healthcare services. I mean, yeah.
Oh yeah, there is a, one of the nice things about living in Iowa is it's still, community. A lot of people I talk to, they think of Des Moines as a really big small town, which is, and you tell people that and they feel reassured, and it's like, wow, somebody out there really does care. So it's just simple, something as simple as a United Way flyer.
Yeah, right.
And a smile,